So here are the tests that can be performed to evaluate a brain tumor will include number 1, the CT scan. A computerized tomography scan of the head is an imaging test that is sometimes used to confirm a brain tumor diagnosis. This non-invasive procedure involves taking a series of X-rays from many different angles. During a CT scan, an X-ray beam moves in a circle around the body, capturing many different views of the brain. As such, a CT scan can provide more detailed information about brain tissues and structures than a standard X-ray. Next is MRI scan, which is a medical imaging technique that uses a magnetic field and computer-generated radio waves to create detailed image of the organs and tissues in your body. Most MRI machines are large tube-shaped magnets. These scans will always show a brain tumor if one is present. Third is the brain biopsy. A brain biopsy is a procedure to a removal of sample of abnormalities for examination under a microscope. The tissue cells taken during the biopsy can show what kind of brain lesion, abscess, or tumor is present and whether it is benign or malignant. And last is the PET scan. A PET scan can show how body tissues are working, as well as what they look like. It can also help to show up a brain tumor by highlighting the areas of the brain where cells are more active than others. You may also have another type of PET scan called SPECT. It stands for Single Photon Emission Computed Tomography. Take note, there is no standardized universally accepted system of classifying brain tumors. They can be classified according to histologic basis, interaxial versus extraaxial, or malignant versus benign.
Let us first define what is benign. It is considered a term that is used to describe something that is not harmful or malignant. This means that it does not spread to other parts of the body and it does not invade any nearby tissues. So why it becomes misleading? It becomes misleading simply because patients believes that the tumor will not harm or will not have any ill effects on them. A benign tumor may still grow and is still occupying some space where it should not be, and this then can cause an increase in intracranial pressure. An increase in intracranial pressure can occur, and this is caused by the growth of the tumor itself, swelling of the brain, or blockage of the flow of the CSF or cerebrospinal fluid. Herniation can also occur. Brain herniation can occur when something inside the skull produces pressure that moves brain tissues. Other than increased ICP and herniation, death can also occur. Remember that benign tumor is usually a good result for the patient, but it does not always mean that it is safe for them.
There are 6 general symptoms associated with brain tumor. First symptoms is headache. In its early stages, a brain tumor may have no noticeable symptoms. The brain itself does not have any pain receptors. But there are several mechanisms that explain why brain tumors cause headaches. The most basic is that a tumor can raise your intracranial pressure, pressure inside the skull, and cause stretching of the dura, the covering of the brain and spinal cord. This can be painful because the dura has sensory nerve endings. The second symptom is vomiting. As a brain tumor grows larger, it takes up more and more space within the skull, thereby increasing intracranial pressure. This increased pressure can lead to feelings of nausea. Brain tumors can also affect hormone levels, thereby causing someone to feel nauseated. That can lead to vomiting. The third symptom is changes in vision. If a brain tumor exerts enough pressure on the optic nerve, blindness can occur. For many patients, the loss of vision is gradual, beginning with blurry vision, double vision, or increasing blind spot. As a tumor grows, however, it will compress the optic nerve, resulting in greater vision loss. Papilledema can also occur. It is a swelling of your optic nerve which connects the eye and brain. This swelling is a reaction to a buildup of pressure in or around your brain. We have a question. What type of tumors affect vision? The answer is optic nerve gliomas, also called optic gliomas or juvenile pilocytic astrocytomas. It is a slow-growing, low-grade brain tumor that grow on the nerves responsible for carrying vision signals to the brain. The fourth symptom is hearing loss. There is a type of tumor associated with this symptom. The name is acoustic neuromas. They are non-cancerous, usually slow-growing tumors that form along the branches of the 8th cranial nerve, also called the vestibulocochlear nerve. This nerve leads from the brain to the inner ear and branches into the visions that play important roles in both hearing and balance. Hearing loss can occur from compression or infiltration of the tumor on the hearing nerve or from secretion of substances toxic to hearing. It can affect the range of sound heard as well as the clarity of sound. Hearing loss can occur even if the tumor is not growing. The fifth symptom is nystagmus. Nystagmus is an involuntary rhythmic side-to-side, up and down, or circular motion of the eyes that occurs with a variety of conditions. When there is an interruption in the normal visual pathways in the cerebellum, which is responsible for the balance, nystagmus can occur. The last symptom is ataxia. It is the loss of full control of bodily movement. Persistent ataxia usually results from the damage to the part of your brain that controls muscle coordination, which is the cerebellum. Dysarthria can also be noticed. It is a motor speech disorder in which the muscles that are used to produce a speech are damaged, paralyzed, or weakened.
Treatment to the patient depends on the type, grade, and location that included different types of approaches, such as surgery, radiation, chemotherapy, or any combination of these. However, the patient, her family, and the medical team must consider different factors in devising a treatment plan for the patient's condition. The registered nurse is the collaborative participant in the care team and could consider these 4 other factors in helping to create a care plan for the patient. The first factor is familial expectations. Stress related to unique care demands associated with the patient condition of brain tumor. Stressors include their loved ones' uncertain prognosis, protracted treatment, survival rate, and reduced lifespan, as well as neurocognitive deficits and personality changes commonly arising from the tumor and its treatment. The second factor is patient expectations. Note, sometimes these expectations differ. These patient's expectations should be considered for the treatment plan in order for her to participate with the care provided to her. The patient may ask and expect regarding her possible personality, behavioral, and cognitive changes during the treatment. Also, the side effects of the different treatments, how painful it would be, financial capability, the risk of the treatment, and her chances to be treated and have successful treatment. The third factor is the invasiveness of the tumor. Considering how invasive or localized is the condition of the tumor, to determine the appropriate treatment needed. A localized tumor is confined to one area and is generally easier to remove, as long as it's in a part of the brain that's easy to get to. And then, the invasive tumor has spread to surrounding areas and is more difficult or impossible to remove completely. For the fourth and last factor, these are the contraindications. Any contraindications the patient may possess that prohibits one or more diagnostic tests or intervention. The patient will be required to undergo different diagnostic tests and different medical interventions. These different approaches may affect the patient's condition or worsen it if contraindications are present. Contraindications should be considered, for example, CT scan dye is contraindicated to patients with hypersensitivity, and radiotherapy is contraindicated to patients with connective tissue disorders and severe lung disease, and chemotherapy is contraindicated to patients with kidney failure. If there are any contraindications present to the patient, plan of care will be devised based on the appropriate alternative treatments and diagnostic tests that can be given to patient FN. As a summary, these are the 4 factors that can be considered to patient's plan of care. First, familial expectations. Second, patient expectations. Third, invasiveness of the tumor. Fourth, the contraindications.
What is dexamethasone or methylprednisolone? It is a corticosteroid that prevents the release of substances that causes inflammation. It is commonly prescribed when a tumor is diagnosed and the presence of increased intracranial pressure is demonstrated. We are going to explain the expected goal of therapy and why it should not be abruptly stopped. Use of Decadron leads to the reduction in fluctuations of cerebral perfusion and improve cerebral metabolism. It can improve neurologic symptoms and reduces cerebral edema within the first 8 to 48 hours of treatment. Continuation can cause acute adrenal crisis similar to Addison's disease. Addison's disease can show signs and symptoms of hypoglycemia, weakness, confusion, tachycardia, and metabolic acidosis.
Anti-epileptic drugs. It may be used in patients with brain tumors to manage seizures. Researchers have found this drug to be preferable for brain tumor patients compared to other anti-epileptic medication, as it does not interact with other drugs that patients are most likely to be taking. Seizures can happen when the brain cells are not working properly or working faster than usual. So levetiracetam slows down these electrical signals to stop seizures. So levetiracetam appears effective and safe for prevention in patients undergoing brain tumor resection and who are significantly higher risk or developing post-operative seizures. So levetiracetam decreases seizure frequency in brain tumor patients with or without craniotomy. Is diuretics like mannitol. So mannitol is thought to decrease brain volume by decreasing overall water content, to reduce blood volume by vasoconstriction, to reduce CSF volume by decreasing water content. So it aims the widespread use of mannitol to reduce brain edema and lower elevated ICP in the brain tumor patients. So next is H2 blockers. So these drugs include ranitidine or famotidine, which work to block histamine receptors in the gut, which decreases overall acid secretions. Next is analgesics. Example of this is acetaminophen. So these agents are used to control pain, which can be manifested through headache. Next is antiemetics. So these agents are used to control nausea and vomiting in patients with increased ICP resulting from a brain tumor. So depending on the location of the tumor, nausea and vomiting can be elicited. As a result, a patient may vomit. So vomiting increases also intracranial pressure significantly and must be reduced at all costs. That's why antiemetic is given. Next is antidepressants like fluoxetine. So antidepressants work by balancing chemicals in your brain called neurotransmitters that affect moods and emotions. So this depression medicine can help improve your mood, help you sleep better, and increase your appetite and concentration. So it is also known that depression is one of the symptoms of a brain tumor. So this is because the frontal cortex, or rather prefrontal, represents cognitive functions such as behavior, mood, and personality. So depression may be one of the symptoms of frontal brain tumor.
What is living will's endurable power of attorney? Living wills express what interventions a client wishes upon the presentation of a serious life-threatening illness. For example, do not resuscitate advance directive can be declared through a living will. A durable power of attorney allows an individual to make decisions on behalf of a client who is unable to make such decisions on his or her own. Although the main focus is to carry out the patient's wishes, the declarations made by the power of attorney are legally binding. These documents are important because they serve to allow the patient to direct which care or interventions should be followed in an event of a life-threatening clinical presentation.
FN a person anxious about the upcoming surgery. It is very important to establish open communication, be compassionate, and actively listen to her when verbalizing her concern. This will make her comfortable, feel safe, and it will also contribute to building a trusting and respectful nurse-patient relationship, which is necessary when undergoing such a procedure. Be sure to be empathetic when discussing the proposed treatment to FN and to her family on why she needs to undergo the surgery and how the surgery is performed. Inform them about the risks, benefits, and possible complication of the proposed treatment, alternative treatment, and also when declining the treatment. We can also discuss about the possible support group that can assist the client and the family if the condition of FN worsen or if her surgery is not successful. We can also involve the family in patient care so that this will tighten their relationship, and it will also promote communication between FN and their family.
The answer would be B, C, and D. The Glasgow Coma Scale is an assessment tool designed to note the trends in the client's response to the stimuli in terms of stimulus needed to cause eye-opening, appropriateness of the verbal response, and degree of purposeful movement. The total score can range from 3 to 15. The client who is unresponsive to painful stimuli does not open the eyes and has complete muscular flaccidity has a score of 3. The client who is oriented, opens the eyes spontaneously, and follows commands scores a 15. A score of 8 or less indicates coma. The Glasgow Coma Scale does not evaluate the ability of the pupil to react to light, the symmetry of the muscle strength of the extremities, or the appropriateness of thought processes. Each of these should be evaluated in conjunction with the Glasgow Coma Scale to provide a complete picture of the patient's neurologic status.
So let's start with Athens' potassium level, which is 2.7 millimoles per liter. This means that her serum potassium level is decreased since the normal value is between 3.5 to 5 millimoles per liter. As a treatment, the physician may order a strict potassium replacement therapy. Take note that such therapy is to be given through IV infusion and not as an IV push, as this rapid injection can lead to venous phlebitis, extreme pain, or in some cases, life-threatening cardiac dysrhythmias or even cardiac arrest. Next, for FN's glucose level, we have 202 milligrams per deciliter, which means that this is above normal. Thus, the physician may order a sliding insulin scale or the increased administration of the pre-meal insulin dose based on the blood sugar level before meal. This is to keep FN's glucose level within the normal 80 to 120 milligrams per deciliter range.
performing a capillary blood sugar measurement, positioning and turning FN every 2 hours, and letter E, emptying the Foley catheter collection bag. Activities that can be safely delegated to the NAP in this situation include non-invasive and non-sterile treatment, such as emptying Foley catheter, collecting and reporting data, performing hygienic care activities, and assisting with ambulation. The nurse cannot delegate to the NAP any aspect of patient assessment, evaluating the effectiveness of care, and any health counseling unless it is reinforcement of previously taught material.